Well, hello, this is BJ Murphy, publisher of Neuse and Neuse.com. And thank you so much for joining us this afternoon for another Facebook Live coronavirus chat. Looking forward to our special guest today, someone who's a native of Kinston and doing great things in the medical community. But first, we had to delay just for a little bit because the governor was live this afternoon. In fact, his press conference is wrapping up just now. But to let you know a little bit about what he said, basically what he's done, we just published this on newsnews.com, is that he has ordered all utilities, now I say all, he has ordered most utilities to prevent utility disconnects for the next 60 days in relation to people's ability to pay or not pay for non-payment. I did notice that he has strongly encouraged phone, cable, and internet services to do the same, but his order today applies to electric, gas, water, and wastewater services. So electric, gas, water, and wastewater services cannot be shut off for the next 60 days. That executive order is online right now on our newsnews.com website. So thank you so much again for joining us. If you have not already, definitely make sure you subscribe to our breaking news text alerts. You just text the keyword NN to 484848. That's NN to 484848. And when we have breaking news, we will send you just a quick little text with a link to our website. It's free, just like everything we do here at Neuse. Everything is free. And also, I just want to say a big thank you to everybody who's watching. If you don't mind, share this broadcast. We've got some really important information about an update on COVID-19 and how it's impacting our own backyard right here in Lenoir County, as well as in neighboring Pitt County with our special guest today. Also, I want to make sure that you know that this morning, the North Carolina Department of Health and Human Services said that we now have just under 1,500 cases. This was as of 9:05 this morning. Unfortunately, our state has had 8 deaths. And we still have 3 positive cases in Lenoir and 3 in Greene County and 0 in Jones. Also, we published this a little while ago. The sheriff's office had a lot of questions about how churches are being impacted with this gathering rule, a lot of like drive-in churches. So if you'll go to newsnews.com, in fact, we'll even put that link here in the comments, so you can take a look at that after we're finished today, so you can kind of get an idea of what the governor's office was, how they clarified that part about the gathering and how churches should handle their services going forward. So really important information. And we're going to take a quick break and we got a real short public service announcement from our friends at Lenoir Community College. Really appreciate that message from our friends at Lenoir Community College. If you have questions about Lenoir Community College, and as a student, a faculty, a concerned partner in the community, please go to lenoircc.edu for more information about how Lenoir Community College has responded to the COVID-19. So look, I want to bring on our special guest, Dr. Ryan Gallagher. He is no stranger to our community, born and raised right here in Kinston, a graduate of Parrott. And I let him tell you, he went off to Carolina. I picked on him about that a while ago, and then I think off to Marshall. And he serves with Physicians East as their infectious disease expert. And so I'll kind of let Dr. Gallagher tell a little bit more about his story and about some of the things we're going to talk about today. So Dr. Gallagher, pleasure to have you on today.
Yeah, thank you for having me. It's a pleasure to be here. And yeah, so I get the question a lot of, you talk to somebody at a party and you tell them what you do and they say, they back away from you as if, what in the world do you do? And, really and truly what I do is just anything that has to do with any infectious disease or infection, whether it's as common as a urinary tract infection to a pneumonia, all the way to as serious as a couple years ago, folks may have remembered the Ebola crisis, and currently now most of my time's occupied by COVID-19. So it's a broad field, but it's never a dull moment, and trying to keep in the front lines, protect the people of Lenore County and the areas and safe. And a lot of what I do is I work with hospitals to help their infection control and infection prevention and to keep staff safe as well as patients when they're in the hospital, because obviously infections can spread very quickly there as well, if that makes sense.
That is absolute sense. And if you're watching and you've got a question for Dr. Gallagher as we kind of dive into the specifics of the coronavirus COVID-19, please drop them in the comments here below. We've got somebody, Aletha Thrower. She's back in the office. She's helping to monitor these comments and questions so that they can get them to me and so we can see if it's something we have time to. We certainly try to get some questions. But Dr. Gallagher, I know you when we were while we were watching the governor, you mentioned before that you really cut your teeth in med school with the swine flu. So tell us a little about that and some of the similarities or some things that are much different about the COVID-19.
Sure, that's a great question. Influenza, so swine flu is a type of influenza, and influenza is a whole nother discussion, but there's different kinds of influenza and thing. But swine flu is also known as H1N1, but that obviously happened about 10 years ago. And my wife was pregnant with our first child, and she also has asthma, so it was obviously a very concerning time. And I think in my last year of med school, I can't remember exactly, but yeah, it's influenza is a lot different, we're finding out, than COVID. And just for the sake of definitions, SARS-CoV-2 is the virus that causes the clinical syndrome COVID. It's called COVID-19. You may hear people say that, but just in case I use those terms. But we're seeing that COVID is a lot different than influenza. There's certainly some similarities and some overlap, but it's its own unique animal. But a lot of the common principles of pandemics, the reason I mentioned H1N1, it was the last pandemic that we had. Pandemic means that it's an infection that occurs all over the world versus an epidemic, which is more localized. But yeah, it's certainly scary and it's its own unique thing. Clinically, influenza presents a lot quicker. Most people who get influenza will have a pretty abrupt onset of symptoms within a few days, and it also tapers off quicker. What we're seeing with COVID-19 is that it has an incubation period of roughly 5 to 7 days. And unfortunately, it doesn't go away as quickly as influenza. And roughly on day 8, there have been a lot of studies that have shown that, particularly out of China and Italy and other places who have had more cases here in the United States. But about day 8 or so, they have a chance of rapidly decompensating. And some people at that point can go from well to not well. And unfortunately, a lot of them may end up being on what we call a ventilator or mechanical ventilation. Or a breathing machine, you may have heard people say. So it's its own unique thing. And what we're seeing right now is it's probably more likely to hospitalize you as well than influenza. Of course, it's hard to really know exactly influenza data because a lot of people don't go to the provider for that and may have mild symptoms. But from what we can tell, COVID-19 is a different beast than influenza for that reason. I hope that makes sense.
It does. And, that was one thing I was curious about. You said sometime around, day 7, 8, or 9, you're seeing more symptoms if you are showing signs of symptoms. And I think that's one of the challenges that we've got as a society. And we just heard from the governor about balancing the act of business and safety of our citizens. And that is, you may have gotten it 7 days ago, but you're just now starting to show symptoms if you even do show symptoms. So that's a big part of the challenge in trying to stop or slow the spread, correct?
Absolutely. And that's a great point, BJ. I mean, I think that's another thing that's different than versus influenza. There's not really a whole lot of times where you would spread it asymptomatically versus what we're seeing with COVID. We're at this juncture, there's a good chance that a lot of the spread has occurred in an asymptomatic state, or at least a mildly symptomatic state, to where a lot of people are thinking maybe it's allergies with all the pollen out or something like that. And they discount their symptoms, because of that time of year, and it's just a dry cough or a little bit of sniffles. And we're seeing a lot of people who carry that and may not have that many symptoms. And that's the hard part, especially children and the younger.
Yeah, I've been watching the data from the North Carolina Department of Health and Human Services, and one thing that consistently amazes me is there's been this almost a misnomer that it's really only impacting the older population, the more of the senior citizens, 65 and up. The reality is there's been a lot of cases between the 25 and 49 range. I guess the difference is they have been shown, at least statistically, not to pass because of this as much as the older generation. So it's almost an inverse. One tends to get a little bit more, but is able to survive it. The other one gets it less, but is actually passing away at a higher rate. Is that seemed to be a fairly accurate statement? I know it was kind of around the horn there.
Yeah. I mean, last that I looked at it, roughly 2/3 of deaths are from folks 65 and older, but actually most of the cases are in the age group that you said earlier. So you're right. It's one of those very disproportionately affects the elderly, but a lot of cases are younger folks, especially in the 40s and 50-year-old range. And that's the tricky part. There's probably more people who have the disease than we're capturing right now because of testing, although testing is getting better than it was even a week ago or two. That's a whole nother question. I'm sure somebody will ask me later, but that's the tricky part, is how really we don't have a good grasp of all the characteristics of this beast, to be honest with you. If every healthcare worker is honest with you, they're going to tell you that.
And you're a practicing physician in infectious disease, and you've got the ability to work at both UNC Lenoir and Vidant and Greenville. Have you worked on any cases yourself, and some of your colleagues as well?
Yeah, so unfortunately, we're seeing more of it. We have had a case, our first case this weekend at UNC Lenoir, and I'm sure there'll be more to come. But thankfully, seems like all the appropriate measures were taken to prevent any exposure to any personnel, et cetera, that didn't need to be. There was really good communication between the community physician and the emergency room staff, and even EMS. And the hospital crew, so we were able to minimize and streamline in a very nice way to ensure that this patient was taken care of, but also to not have the collateral damage of the staff. I will say it's been we've had a hard road preparing for this, but I've been impressed with the work both of Vidant's done as well as UNC Lenoir in terms of the preparations that have been done. He's probably not going to like me calling him out, but my dad, the senior Dr. Gallagher, has definitely done a lot of good work as well. And, I realize now, getting older, how smart that guy actually is. But there's been a good teamwork with a lot of different doctors and providers and staff, and the leadership at UNC Lenoir is really trying the best to prepare to keep this East North Carolinian safe. And I think we've done the best we can do to prepare. It's kind of like a hurricane. You prepare as much as you can, and you just got to grin and bear it when it comes and hope your preparation was good.
Yeah, that's true. And I failed to mention that earlier. I did say that you were a native of Kinston. I didn't mention that your father is Dr. Gallagher. Most of our community knows Dr. Gallagher. He's a pulmonary physician, if I'm not mistaken. And his wife, your mother, is a small business owner in downtown Kinston. So both of them are no stranger to the medical and the business community, and certainly the larger part, the actual civic side of our community. So they've given back a lot. And I know they're happy to have you and those grandbabies closer to home. There's, one question we had a while ago was, at what point are you actually, if you get it, at what point are you actually considered contagious?
Yeah. So again, that's one of the things that as any pandemic takes shape in each country, there might be a little bit of different characteristics of the epidemiology in the United States versus Italy or versus China. But as a general principle, roughly, again, there's a phrase called incubation period, which means how long do you what's the time lapse between getting exposed to a virus when you actually get symptoms. And it's a median of about 5 to 7 days after you get exposed. There's some data points that actually could be as long as 14 days. So that's a lot of the guidance that the public health department is doing, why they say 14 days, because they want to capture, make sure there's nobody shedding that, if that makes sense. Does that answer your question?
Yeah, I believe so. And, one thing in terms of how contagious it is, because that's been one of the most interesting things that I've noticed, and I'm sure that you, as someone who studies infectious disease, has probably noticed. And one thing a question I've got is really, this may be very basic, but how do you, if it's this contagious, how do you actually avoid getting COVID-19?
Yeah, great question, BJ. I'm glad you asked. The best is social distancing and being 6 feet away sorry, I'll rephrase that. Being within 6 feet for more than 10 minutes is one of the higher likelihood of acquisition of disease. It's obviously spread by droplets. So the farther you are away, the more likely you're not going to be exposed. So again, the social distancing thing is really important to this. Certainly in the hospital where you don't have the luxury of doing so much social distancing, there's other metrics that we use, such as the proper personal protective equipment, droplet masks, eye protection, proper gowns and gloves, et cetera, that we do in other infectious diseases as well to prevent them from spreading. But again, I think the biggest take-home point that I would try to portray to the public is to really, as hard as it is, and look, I've got 3 young children. It's tough. I miss my Chick-fil-A. I miss my, Sam Jones barbecue. But really to social distance the best they can.
Yeah, it was a challenge for me because my kids are at home, and I went home for lunch, and both of them wanted to come with me this afternoon, and I knew that there was a chance that there was going to be 1 or 2 other people in the office that typically aren't here, and I just said, I think it's best you stay home, and we're working on a potential guest early next week to talk about the mental health side of this. It's something I really want to dig deeper in because as a parent, I'm concerned about it. We did have another question. Someone said, back in February, I was feeling, I had flu-like symptoms. The flu test came back negative. And do you think there was a chance that people in our area actually had COVID-19 in February and before March, actually?
Yeah, a great question. And I think that's a large possibility. That's the difficult thing with testing. What we're seeing right now is we're testing people, is we're catching probably the cases that have been going on for a good bit based on the epidemiology. But yeah, there's a good chance that back in February, you very well could have had that. The tough thing about this is if COVID-19 hit, let's say in June or July or something like that, there would be other viruses that we wouldn't. But, of course, it hits in respiratory season. So there's also tons of other viruses you could have very well had as well. And it's a tricky situation to answer for sure. But to answer your question, it's a possibility. Absolutely.
And there was a question that we received on our Facebook Live, and I really appreciate you taking a few moments to help answer some of these questions as well, because we're live, so we're trying our best to get these questions and filter them and make sure they get them to me and ask you if we have an opportunity. But this question was precautions that communities should take when going to the grocery store, particularly the 65 and up generation. With the low amount of cases in the area, is it still recommended to practice the extremes of disinfecting purchases and even changing clothes when you get home?
Yeah, right. So I'll tell you, my suggestion would be to, if you can, wear gloves. And again, the social distancing thing is the best. People ask me all the time, should I be wearing a mask? And masks really are more preventative of the patient who's sick to prevent it to others. It's not going to be the only factor to keep you from getting it. So that's why you'll see a lot of public health measures stating, like this Surgeon General just recently said, to not have to wear a mask. And that's because people will have a false sense of security with the mask and wear a mask and they don't wash their hands, for instance. So, but going to the store, I don't think you necessarily need to wear a mask, but I think it's a good idea to practice some good hand hygiene. That's another thing in addition to the social distancing is really good hand hygiene. So yeah, I think you just be smart. Don't touch your face. Do what you need to do. Don't talk with people. Certainly don't shake hands. Stay 6 feet apart. As hard as that is to do, and then get home. And I think that, taking some sort of common disinfectant and wiping down things the best of your ability. And it doesn't have to be bleach. This virus is killed very easily to very common sterilization, household cleaning supplies, etc. So, and just again, good hand hygiene. And after you do that, you wash your hands. And I don't think you need to change your clothes and do all that kind of stuff unless you spilt something or you visibly soiled your clothes or something like that. I think that is probably sufficient.
But I noticed the other day I was at the grocery store and I was thinking, well, let's see if they got any hand wipes or something. Of course they didn't, nothing antibacterial, but they did have some baby wipes. And I was like, well, wiping something down or off with something moist like this is probably better than nothing. So I picked them up anyway. I don't know if it helps me or not, but I was like, I'd rather have it than not have it.
Yeah, right. Yeah. Again, it's the nice thing about this virus is that it's not hard to kill with any cleaner at this point is going to pretty much do it. It doesn't have to be bleached. There are infections you have to bleach. But yeah, that's one good thing about this.
Well, and we had a couple questions before we went live earlier today. One question was, what are some of this may be challenging because it's such a new virus, but what are some long-term outcomes for those who were infected, both symptomatic people who actually showed signs of it and asymptomatic people who did not? What are some long-term outcomes for those that were infected?
Yeah. Well, the good news, at least, and again, I'm laughing because a lot of what I could be telling you in a year from now could be wrong, because this is still a pretty new virus on the scene of the modern landscape of medicine. But at this juncture, it appears that if you recover from it and you're not in the unfortunate category of those who get intubated or really sick, your long-term prognosis is actually pretty good. Certainly people who have asthma or other reactive airway disease or other pulmonary diseases might flare and have some issues. But again, the current understanding is if you make it through this illness, then your long-term prognosis is okay. But unfortunately, as you mentioned earlier, there are some, the elderly, for instance, or comorbidities, i.e. with lung disease or things like that don't. But again, what we know right now is if you make it through and you get better, your long-term prognosis is good.
And do you know the outcome of some of the patients here in Lenoir and even where you practice as well as in Pitt County, where they tested positive a week or 2, 3, 4 weeks ago, how they're doing today? Can you give any insight on some of the patients who previously tested positive?
Yeah, so I have to be a little bit, I can speak in generalities to that. To give you a statistic, currently there are 1,498 total cases in North Carolina, and of those, 157 are hospitalized. That's roughly a 10% hospitalization rate. So another way you could say that is 90% of people who have this disease are going to be outpatient or outside of the hospital. So again, most people who get this, we talked about earlier, could be anything from completely asymptomatic to mildly symptomatic, if that answers your question.
No, that's good. And I know that the HIPAA rules, kind of dictate a lot of what you can and can't say. And I think everybody appreciates that. In fact, I've seen some conversations about people wanting to know more information about someone who tested positive and how they might or might not have come in contact with them. It's very challenging for the government to release that type of information. Yeah. There was a question on our live feed about gastro issues being present as symptoms. Have there been any cases where gastro issues present themselves before coughing and things like that?
Yeah, they can. In fact, and I'll add real quick that we currently have 8 deaths in the state of North Carolina. So I'm not good enough with math to know what the percentage, the mortality rate at this juncture is. But again, we have 8 deaths. So again, most people do well in terms of, if you look at it, what we call the mortality rate. But it's just that that minority of people who are very unfortunately very fragile, and those are the ones that risk. But yeah, so that's the biggest thing I think that we're talking about. But yeah, I think overall we're hoping and praying that these metrics, as we get more data and more testing, that the mortality is not as high as it was. BJ, do you mind repeating your question? I forget. I wanted to get that mortality data.
It was No, that's fine. It was about gastro issues. Have you seen cases where gastro-related issues actually might come before the more common symptoms, say like a cough?
Yeah, sure. Thank you. And sorry about that. But yeah, so there was some data that came out of China that would indicate that roughly, I can't remember exactly, but there was a large minority of, I want to say somewhere along the range of 30 to 50% of people had GI symptoms with their COVID. Hard to completely pull out that data to know if that came, all those symptoms came before the respiratory or if they were concomitant with the respiratory. It's hard to parse some of that data out. I will say that there is a decent amount of literature that suggests that some people might present with gastrointestinal symptoms for a day or so before they get their respiratory symptoms. But large part and parcel, as we say, is still a respiratory infection. So it's kind of like influenza if you think about it in that way. There'll be people who have flu-like symptoms, and it's not uncommon to get some diarrhea with that.
And a couple last questions, and it involves testing and medical supplies, ventilators, those types of things. These are a couple of major issues I've seen across the country, and in fact, we've had a lot of these questions as we've done a lot of these coronavirus chats at 4:00 on during the weekdays. Tell me about testing as it stands right now, Pitt and here in Lenoir. Do we have enough testing equipment? Could we do more? Is there anything that we can do to help you?
Yeah, I think so. That is something that's really gotten better the last week or two, particularly. I mean, even compared to 4 weeks ago, it feels like it's a whirlwind. But we do have testing. We don't have it as much as we would like, but it's getting better. We're able to even now relax more of the testing measures than we had to implement a couple weeks ago. You got to remember, a couple weeks ago, we didn't have that many kits. It was a really difficult question of who needs to be tested, because all these other diseases are not going away. I mean, if certainly influenza is not going away. And so, you have the thing you don't want to have happen at the beginning of this pandemic is that now everybody with a cough has COVID when it's, and then so we waste our kits for people later on. Now, so that was a really tough issue we had to deal with a couple weeks ago. But currently now we're getting better. We have mechanisms at the hospital to get a turnaround test at UNC Lenoir within 24 to 48 hours. Thankfully, the head UNC is doing those for us because they have the capabilities, and we use a courier to get it to them. And that's a rapid turnaround. And we're going to get that testing in house soon when there's some reagent issues from the suppliers to give us the kits to be able to do it. And then Vidant's the same way with, they're doing it in house. So a lot of testing is getting better. We also have a lot of better capabilities of testing in the outpatient setting. There's more and more labs starting this process. There's a category the FDA has allowed called emergency use approval, or EUA, that allows labs to get kind of contingency approval. And thus, there's been a lot of labs that have jump-started that outpatients can use and things like that to get testing available. So certainly we have some work to do, but we are far along, much better than we were even a week or so ago.
And let's talk real quick before we wrap it up. And thank everybody who's asked a question. We're going to stop here at the questions. But if you've got more, please feel free to submit them. And we'll try to, next time we bring Dr. Gallagher back, we'll try to get to them. But Doctor, a couple last questions, and it relates to the medical supplies. Tell us about the medical supply situation here, the PPEs, the personal protective equipment, as well as ventilators, and not just about the ventilators, the staffing around it. So the PPE and ventilators. So let's kind of wrap up with that.
Yeah, sure. So thankfully right now, the ventilator situation, we're good. We have plenty of ventilators. It's an interesting metric about, the doubling time and the ventilator requirement. What that is if anybody says they for sure know, they're lying. Nobody knows what the peak's going to be in the sense of how much vents we'll need. But right now, we have enough ventilators. The personal protective equipment aspect is certainly a tenuous issue. We are trying to, and it's not just this hospital or any hospital. You got to remember, this is a nationwide problem. In fact, it's better here than a lot of places. But we do have a limited supply of various personal protective equipment. But we are getting that is getting resolved again, even better than a week or so ago. Again, not where we want to be. We certainly would love to have some more PPE. We're getting creative, but safe. on how to use PPE longer, and the CDC is giving guidance about that, and we're taking lead from them, and also being taking lead from some places like University of Nebraska, who's got a really good biocontainment facility there, and they've really got a lot of up to a cutting edge infection control measures. And so the hospital and I are working about trying to share, get what works with other places and use it here to keep. Again, we want to use our supply. We don't want to deplete it, but we also don't want to use it if it's dirty or unsanitary. So we're trying to really have that perfect mix of just using it just like you need to, but not using it when it's dirty or not going to work, if that makes sense.
100%. Thank you so much for updating and clarifying some of that. And I'll give you a chance to any parting words to the audience, anything you want them to know to do leaving this conversation here today.
Yeah, I think that the biggest thing is what I would say is be patient. This is a hard time. This is, this is a situation which a lot of us haven't had to deal with before. There's a reason social distancing is being preached. There's a reason that hand hygiene is being preached. Just continue the course and, listening to the authorities about what's the best way to keep yourself healthy. The North Carolina Department of Health and Human Services or the CDC are great sites. They try to keep it up to date. But again, just wash your hands, stay 6 feet away from people, and just try your best to be consistent with that, as hard as it is. And just hang in there and just pick each other up. And certainly, thoughts and prayers would be much appreciated for all of us in healthcare right now.
All right. Thank you, Dr. Gallagher. Really appreciate, glad you're back home in the Kinston community, and really appreciate your service to the medical profession.
Absolutely. Thanks for having me. If you want me to come back and just let me know. I'd be happy to do that.
We definitely will take you up on that. So stand by. Well, look, thank everybody for watching this episode of Coronavirus Chat here on Neuse News. If you didn't get something out of that, you were probably sleeping during this, because Dr. Gallagher was full of information. You could tell he really is on the front lines of this fight against COVID-19. And if you heard him, it's kind of the way I've ended most of these broadcasts. Wash your hands. You heard him over and over say that. I know we've got, we can talk a lot about the specifics and symptoms and things, but some things that we basically can do ourselves are practicing that 6 feet away, practicing minimizing how much we're going out, washing our hands, having good hygiene. And I tell you what, if you don't mind, throw a few hearts up here for our medical profession, just as a small way of saying thank you. In fact, if you want to, you can even tag a nurse or a doctor or a PA or you name it, and just say, just tag their name right here in the comments and say, I appreciate you. I really thank you for all you're doing. Emergency medical folks, those on the front lines of this fight, just tag them and say thank you. Something really simple can go a long way in building up their morale, because our country, our nation, our community is really dependent on them being at their best. That means well rested. That means safe. And that means keeping us all protected as well. So a couple last things I want to mention. Don't forget our breaking news text alerts. Just text the keyword NN to 484848. That's NN to 484848. As always, it's free, as what we do here at Neuse News. Oh, by the way, we got our news hashtag News Crew t-shirts in. For those that donated to help with that, you can pick them up. We're working on procedures to do that. We shot a little fun video about that yesterday. But if we still have a few more, just go to neusenews.com/t-shirt. We'll throw that in the comments. neusenews.com/t-shirt to help with that. And we just published the governor's executive order he signed today. And just to summarize, basically he's saying if your utility company, gas, electric, those types of things cannot cut you off for failure to pay for the next 60 days. And I don't think he's saying don't pay. He's just saying that if that happens, then they can't cut you off. So make sure you go to neusenews.com, read that, subscribe to our newsletters in your inbox daily at 7 a.m., chock full of information. And as always, thank you to everybody who subscribes to that. To all of our advertisers, small way to say thank you is to go click on their link buy drugs from them, buy food from them, shop there as a small way of saying thank you for supporting what we're trying to do here at Neuse. Big thank you to Dr. Travis Town behind the scenes helping to live stream this entire broadcast, and to Aletha Thorough for helping to moderate the social media contents. Thank everybody for watching, for subscribing, for liking, for commenting. Y'all have a great day, and wash your hands.